Bronchiectasis is a chronic respiratory disorder characterized by permanent dilation of the bronchi, which leads to impaired mucus clearance, recurrent infections, and inflammation. This condition can result from various etiological factors and is associated with significant morbidity and mortality if left untreated. Understanding the etiology, pathophysiology, clinical presentation, diagnostic approaches, and treatment strategies for bronchiectasis are crucial for healthcare professionals in order to provide optimal care for affected patients. In this detailed script, we will explore each of these topics in depth to enhance your knowledge and understanding of bronchiectasis. Bronchiectasis can be caused by various factors such as infections, genetic disorders, and immunological conditions. Recurrent lower respiratory tract infections, including tuberculosis and pneumonia, are common causes. Genetic disorders like cystic fibrosis and primary ciliary dyskinesia can also lead to bronchiectasis. Risk factors for the disease include smoking, exposure to pollution, and respiratory infections. Identifying these factors helps in managing and preventing complications. Bronchiectasis is a condition characterized by permanent dilation and thickening of the airway walls. Impaired mucus clearance, chronic inflammation, and recurrent infections contribute to the pathophysiology. This leads to the accumulation of mucus and debris, bacterial colonization, and tissue damage, perpetuating the cycle. Bronchiectasis is a chronic lung disease with variable symptoms including chronic cough, foul-smelling sputum, shortness of breath, recurrent respiratory infections, hemoptysis, and exacerbations triggered by infections, irritants, or weather changes. Patients may experience weight loss, fatigue, malaise, and clubbing. Early diagnosis and treatment are crucial. In summary, the diagnosis of bronchiectasis requires a comprehensive approach involving clinical evaluation, radiological imaging, particularly chest CT, and microbiological investigations, such as sputum culture and sensitivity testing. This allows for identification of the underlying cause and appropriate treatment. Radiological imaging plays a central role in diagnosing and assessing the severity of bronchiectasis. Chest CT is the preferred modality due to its high sensitivity and specificity in detecting bronchial dilatation. The radiological findings in bronchiectasis include bronchial wall thickening, dilatation of the bronchi, lack of tapering of airway lumens, and visualization of bronchial arborization in peripheral lung fields. The dilated bronchi may exhibit a cylindrical or varicose appearance, depending on the underlying cause and disease progression. Additional findings that may be observed on CT include atelectasis, consolidation, and bronchial wall calcification. These findings often indicate the presence of complications such as recurrent infections, mucus plugging, or broncholithiasis. Radiological imaging is valuable not only in confirming the diagnosis of bronchiectasis but also in guiding treatment decisions, monitoring disease progression, and evaluating response to therapy. Regular follow-up CT scans may be warranted in some cases to assess treatment efficacy and detect potential complications. Microbial colonization and recurrent respiratory infections are common in bronchiectasis and play a significant role in disease progression. The most frequently isolated pathogens include Haemophilus influenza, Streptococcus pneumoniae, Moraxella catarrhalis, and Pseudomonas aeruginosa. The microbial profile in bronchiectasis can vary depending on the underlying etiology and disease severity. In patients with cystic fibrosis, Pseudomonas aeruginosa is the most commonly isolated pathogen and is associated with a worse prognosis. Nontuberculous mycobacteria, NTM, and Aspergillus species are also important pathogens in certain subgroups of patients, such as those with immunodeficiency or allergic bronchopulmonary aspergillosis. Microbiological investigations, including sputum culture and sensitivity testing, are essential for guiding antimicrobial therapy. The selection of appropriate antibiotics is based on the identification of the causative pathogens, their antibiotic susceptibility pattern, and the severity of the infection. In cases of recurrent infections or chronic colonization, long-term suppressive therapy may be necessary to prevent exacerbations and disease progression. Bronchiectasis can be mistaken for other respiratory conditions like COPD, asthma, chronic bronchitis, interstitial lung diseases, or asthma with bronchiectasis overlap syndrome. Accurate diagnosis and proper management require a thorough evaluation and consideration of the differential diagnosis. Bronchiectasis can cause respiratory infections, hemoptysis, respiratory failure, cor pulmonale, and amyloidosis. Proper management, including antibiotics and airway clearance, can reduce complications and improve outcomes. The treatment of bronchiectasis involves various approaches such as airway clearance techniques, pharmacological therapy, immunization, pulmonary rehabilitation, and, in some cases, surgical intervention. Individualized treatment plans based on the cause and severity of the disease are essential for optimal outcomes. The prognosis of bronchiectasis varies depending on the underlying cause, severity of disease, and adherence to treatment. Long-term management focuses on reducing exacerbations, optimizing symptom control, and preventing complications. Patient education, smoking cessation, and healthy habits are crucial for optimal respiratory health. Ongoing research in bronchiectasis focuses on biomarkers, targeted therapies, novel imaging modalities, immunomodulatory treatments, and telemedicine. These advances aim to assess disease activity, predict exacerbations, improve mucus clearance, evaluate disease severity, target specific inflammatory pathways, and enhance disease management. In this video segment on bronchiectasis, we will explore 3 diverse case studies. These cases encompass different patient demographics, clinical presentations, diagnostic approaches, and management strategies. By examining these case studies, we aim to enhance our understanding of bronchiectasis management and develop critical thinking skills applicable to real-life scenarios. Bronchiectasis is a chronic respiratory disorder characterized by permanent bronchi dilation and other complications. This script provides an in-depth overview of its etiology, pathophysiology, diagnosis, treatment, and more. Continuous learning is crucial for optimal patient care.